tics, I mean, there are minor things like blinking of the eyes on a repeated basis and things, and there is more severe ones. But I mean, do you want to quickly summarize something about tics, and then we'll go on to autism as a closing topic?
Yes, yes. Tics is one of the conditions which we again see commonly in our day-to-day practice. This is where this can present in different ways, but one of the common tics which we do see is the motor tics, which is the repetitive movements, which could either be the repetitive blinking of their eyes, or it could be the nasal flaring kind of movements that they make, or opening of the mouth and jaw differences, or it could just be shrugging their shoulders repeatedly. So these are some of the behaviors which are seen, most often presented by parents or school as the child is trying to be silly, or the child is trying to be distractful, or the child is not serious of the situation that is happening. Usually most of these are very benign, so we do tell the parents not to worry, especially if it's facial. They do worry, saying that is there something going on, like a seizure, which is the most common worry that the parent has. So we do tell them this is a condition which leads to involuntary activation of the muscles. However, this is something which is suppressible to a certain extent as well. So we do tell them about reinforcement. Behavior therapy comes into play. So there is a CBIT, which is the behavior tic related therapy, which psychologists do. So for older children, this can really help them in regulating. Most often, the triggers like poor sleep, anxiety, exam stress, these can trigger a lot more than otherwise. So avoiding those situations and being able to take control plays a very important role. And most often, 80 to 90% of the cases we see, they are transient and they fade away with time. So that becomes important. And two, even emotionally, when they are quite dysregulated, this keeps coming in and going up intermittently. But anything which persists beyond a year is when we understand is more chronic and needs a deeper evaluation.
And in terms of Tourette's and all, it's more severe, and obviously none of these milder ones will progress to Tourette's, or can it be that it starts like minor and progresses?
It can start minor and can go into something like Tourette's, which is a fair possibility as well. So we do tell them to keep a watch. If it is persisting, increasing either in frequency or in terms of the complexities of presentations, or it's affecting the child, then we definitely will have to evaluate for a possibly ongoing into a Tourette's as well. One of the most, I think, challenging aspects in this, although we tell the parents that this is going to be benign, is for older children especially, they start being bullied or being teased in the classroom, or being mistaken as, like we said, not paying attention or repeatedly doing this to act silly. So it becomes important to give them that emotional guidance and support, and also making the teacher be aware of this condition, that this child is not doing this on purpose. This is what is the condition which is causing it, and we would need them to try regulate, help them regulate in the classroom as well.